In other news, Opposition leader Dr. Gail Rigobert says the concerns over cost of maintaining the new medical complex at the Millennium Highway and fears of increases in healthcare costs must be addressed. Dr. Rigobert was at the time speaking in Parliament where a bill on the governance of the Millennium Medical Heights complex was being debated.
So questions of cost. How much will it cost to run that complex, the amalgam of health institutes? And earlier on, one of my colleagues made reference to the fact that already there are price differentials between the services and the cost attached to those services between the two institutions in the north and in the south of the island. And whether we ought not to give consideration to the harmonization of services and prices to ensure some equity in the delivery of services. The anxiety, I'm sure, is that can one expect automatically that prices will go up? What is the expectation? And I think it is the responsibility. I heard the member for Babino and the minister responsible for health say in passing that there will be some health education or some sensitization programs, but I'm sure at the center of those ought to be something that speaks to that concern. What will health services cost? Will we have an expanded array of health services? Will we step up in the quality and quantity of services? And how will that impact price? I think that is what every St. Lucian wants to know at this point.
Member of Parliament for Labrie, Alva Baptiste, in his contribution to the debate, noted that St. Lucia has to face the reality of funding its own health care costs.
Mr. Speaker, the whole idea is we must begin to chart the way forward as far as raising revenues to finance expenditure. Even the EU is now entering into a new covenant with islands in the Caribbean region. In fact, the hot debate right now is that we are upper middle income countries no longer qualifying for certain type of aid flows and certain types of concessions. Therefore, we need to make greater efforts at home to raise our revenues to finance our expenditure. So this particular strategy has nothing to do with increasing the cost of healthcare, but not to distort the pricing mechanism in the provision and access of healthcare, Mr. Speaker, but rather to match our basic need with greater possibilities and to improve the system so that St. Lucians will be able to access quality healthcare at home. And so instead of going overseas for those treatments, we can do it at home and of course attract people from other Caribbean islands so that we will impact positively on the revenues of this country.
In police news, the Royal St. Lucia Police Force says it is yet to receive a report following media reports alleging that a 65-year-old tourist was attacked by a police officer attached to the Marigot police station. The incident is alleged to have taken place at Marigot Beach on Monday, December 15, 2014. The RSLPF would like to remind the public that there is a procedure in place for dealing with matters involving the police. All concerns can be directed to the Police Complaints Unit located on Brazil Street, Castries. This is the CTV News. We'll pause here for a moment. There is more news ahead. Please stay tuned.